Hello moms to be. The countdown for meeting your little one has officially started. And let's be honest, figuring out when it's time to head to the hospital can make you feel a bit confused, right? Are these contractions real or just Braxton Hicks contractions? Did my water actually break? So there are so many such questions in your mind. Don't worry, I'm here to break down all the signs of labor and also help you understand when is it right time to visit your doctor. Hi everyone, I'm Dr. Fathima, clinical pharmacologist and an expert coach in pregnancy and parenting. First thing is first, labor doesn't look the same for everyone. It can be quick, intense for some, while others might have hours or even days of slow progression. And that's totally normal. The key is to recognize the signs your body is giving you so that you're prepared to visit your doctor. Contractions are the biggest indicator that labor is starting. But how do you know that they are real or the false contractions? See, I'll tell you something here. Braxton Hicks are irregular. Braxton Hicks means the false contractions. Just remember this. Okay, keep the technical term aside. If it is false contractions, it can be irregular, often painless, and go away with change in position or just by drinking water. If it is true labor contractions, they are consistent, grow stronger over time, and don't stop no matter what you do. The tip here is just use 5-1-1 rule to time them. So what is this 5-1-1? When the contractions are 5 minutes apart, lasting 1 minute and continue for 1 hour, it's probably time to visit your doctor. Okay, we all have seen those dramatic movie scenes where the woman's water breaks in a giant gush and everyone panics. But in real, it's not always so dramatic. Your water breaking can feel like a trickle, a gush, or something in between. If the water breaks, note the color, order, and time, then call your doctor. I've got a heads up for you. If the water is greenish or brownish in color, it could indicate meconium. Meconium is nothing but baby's first poop, which needs immediate attention. So don't wait for anything, just call up your doctor. Now let's come to that lower back pain and pressure. If you are feeling intense rhythmic back pain or heavy pressure in your pelvis, your body might be getting ready for delivery. This is especially common in back labor where the baby is positioned to put extra strain on your back. And now let's talk about mucus plug. It's also called as bloody show. You might notice a pinkish or bloody discharge as your cervix starts to dilate. This is called as bloody show, and it is a sign that things are progressing. It's not a reason to rush to the hospital immediately, but yes, it's a good indicator to stay alert. Nausea, diarrhea, or flu-like symptoms. It sounds odd, but some women experience nausea, loose stools, as the body clears out in preparation for labor. It's messy, but it's real sign to say that things are moving along. Let me give you a quick guide on when to visit your doctor. First and foremost thing is contractions. If your contractions are consistent, just remember that 5-1-1 rule. If your water has broken, just call your doctor immediately and let them guide you. If you are experiencing heavy bleeding or severe pain, this could be a sign of some complications. So don't wait for anything, just go and visit your doctor as soon as possible. And not only this, if you feel reduced fetal movements, if your baby isn't active as usual, it's always better to get it checked out sooner rather than later. Now you got to know the signs and you have visited the hospital, right? And what would happen in the hospital? See, once you check in and share your symptoms, the doctor will monitor your contractions, check your cervix, and possibly they may as well suggest you to go for an ultrasound. If you're not in active labor yet, then they can as well ask you to go back home for a bit. And don't be discouraged, this is completely normal. I know this process can feel overwhelming, but trust me, your body knows what to do. The key here is to stay calm, listen to your instincts, and lean on your support system. You're about to meet your baby, and that's the most magical part of all this. Now you are all set to recognize the signs of labor and head to the hospital at right time. If you found this video helpful, don't forget to hit that like button, subscribe for more pregnancy and parenting tips, and don't forget to share this information with a fellow mom to be. You got this. I'm here cheering you on every step of the way. I'll see you in my next video. Till then, take care.